Recording. So I guess just open the meeting.
Yep. So we call the meeting to order at 6:07 p.m. Board of Health meeting agenda for Tuesday, September 28th, 2021. The first topic on the agenda is 502 North Main Street, a new well. And so we are looking to PVI Site Design LLC. So who do we have here for that?
That's me, Tim Power, representing the owner of the property. Do Pam, do I have the ability to share a screen just to put a?
Yeah, or you know what, I can actually do it. But I can just give you power here. Hang on one sec.
Not that it's too complicated, but it's always nice to look at pretty pictures.
I know. You know what? Why don't I just do it?
Sure.
I was actually going to start off with where you are land-wise. Sorry about that. Oh, here it is. So just for the group to know, like, so here's the golf course when you're on North Main Street, and this is the site on the right, like the T station's right across the street from there. Just to give everybody their bearings, and I'll switch over to the actual figure. There we go.
Sure, and I don't know if you can zoom out just a little bit, get that full shape of the lot again.
Okay. Okay. All set?
Yeah. So we're here tonight formally to request a variance from a setback for a well. But at the same time, there's a lot going on here. There's the well. There's a replacement of a existing septic fields for an existing house that's going to be renovated, and also a construction of a second house with a new septic field. So happy to talk about all of those. But again, the purpose of this hearing is really just to seek the variance for the well. So under existing conditions, the house up front near North Main Street at the bottom of the picture there is an existing house and has an existing shallow well. You can see the circle, kind of the bullseye, just in back of the house underneath the deck. This is a shallow well. Even if the applicant was just seeking to renovate this house, they'd likely be doing a new well, a full aquifer, full depth, 100 feet plus size well for that use alone. Fast forward there, this parcel that you saw on the GIS map is actually broken out into 3 lots historically on the deed. There's the front lot with the existing house. There's a middle lot where the new proposed house is shown, and there's a lot in the rear. That's lot 3. Lot 2 and 3 will be combined into one lot for the second house in the rear, and then lot 1 stays. And the owner has, I'm told, has checked with the building inspector, and although these lots are smaller than current zoning, he's accepting them as buildable lots because they were created prior to current zoning, I believe. So, which brings us back to the 2 houses and the shared well. So we'd like to do a new well. However, given the need for the septic systems and the leach fields, they create a 100-foot setback requirement from the well. In addition, the regulations call for a 100-foot setback from the wetland line. The wetland line you can see on the left side of the property with sort of little triangle dots marking wetland flags. When you combine all of those setbacks together, there is no land left on the parcel to put in a new well and not be within a setback. So we picked the lesser of 2 evils here and are asking to move it, reduce the setback from the wetland from 100 feet to 50 feet. And knowing, given the constraint on this site, given the constraint of the setbacks, and then knowing also that the new well will be a modern deep aquifer well, close to 100, maybe more feet deep. The wetland is generally a more surface water and sort of perched water table and not truly the aquifer below. So there's not really an interconnect between the water that the well will be drawing and the water in the wetland system. And that's the basic of our requests for now. We'd like the well to be shared. We've submitted an application to Pam to create a shared well. We're creating the necessary easement documents between the two lot owners, or between the two lots that will travel with the land, so that their costs are shared and maintenance agreements in place. So again, those are to be provided still. And again, just finish off, for now, we're just looking for this variance to put the well closer than 100 feet, up to 50 feet to the wetlands.
Okay. So can I just ask what, so I believe there's town water provided to that part of town. Can you talk a little bit about the rationale for drilling versus piping into town water? I could be wrong.
Sure. So the town water actually ends over well off the page to the left. So there's not town water right in front of this property. And the cost of running it down the street just becomes cost prohibitive. I believe it's about where the T is in the T station, right across on the bottom left of the page, right around where the driveway is for the T station, and there's a hydrant there, but it ends at that location. So the owner did look at that, and I believe they talked to DPW about their process, but it was well in excess of his budget and what he'd be able to provide.
And okay, thanks. And I'm interested to hear that there's no crossover between the aquifer and the wetland, even if it's drilled. I mean, there isn't naturally a crossover, but if the yard floods, is there not a concern about wetland water flowing into the well?
Well, I think we can take steps to prevent that. So the well, will stick up above the land. The wellhead usually sticks up 2 to 3 feet above the surface, and then it's capped, right? So at the surface, it's really a closed system. So it's difficult for water to get in there.
Are you not having to go before conservation?
Robin, I think you just had a question, Robin. We couldn't quite hear you.
Are you not having to go before conservation, since you're asking for a 50% reduction in the spacing?
So we do need to follow up with conservation. This project, the two houses, went before conservation before we realized we had a need for the well. So the project was permitted for just the disturbance in the buffer zone and stormwater. We'll need to go back and amend that order of conditions for the well installation. Obviously, if the variances are granted, then we won't initiate that process, but that will have to be a step we take.
The question I have is, should not conservation rule on this before the Board of Public Health? Michael?
That's a good question. I think you have to get both. I don't know that order of operations is important. Pam, do you know?
Yeah, so I think you're allowed to say, if you want to grant the variance, you can say it's contingent upon them getting permission from Concom. So the permit would only be issued if you've got an agreement from Concom.
That's reasonable.
Yeah. So then, you're the engineer. I'm sure you thought about these things, but humor the chemist.
Sure.
So the existing dug well, the shallow well that's going to be removed, it's too close to the septic system. You couldn't drill near the existing house. You can't drill outside the wetlands, but near the existing house because of the septic system setback?
Yes, because of the new house. Actually, both septic systems that are there. We're not entirely sure. We didn't find any records on the existing septic system for the existing house. Just anecdotally, the owner said it was a cesspool or something that wasn't going to pass, so he was doing a new system. But with the 100 feet setback from the leach fields, from the soil absorption system, we don't have the space to do it from either the new or the old that's there.
Got it. Thanks. Robin, Lynn, any other questions? Nope. Okay. Any thoughts? Would anyone like to deliberate this, or would we like to have a motion to extend the variance contingent on the Concom review?
Can I make one comment or question?
Yes. Yes.
Jason Federico, I'm the field engineer for the town, Tim. You didn't show any of the adjacent parcel septic systems. Are you sure there's nothing in relationship to this well location with regards to those systems?
That is a valid point. We certainly can look into that. I can't answer that off the top of my head, so we certainly can confirm or not.
Because that's going to be my question for your other proposal too, which is you're going to need to show their private wells on your plan when you come back for septic as well.
Sure.
Because we're going to need to make sure that we're protecting the neighbors as well as
Based
on
upon,
both scenarios.
based upon that lack of data, it might be prudent to continue this until we get a better idea of what's happening with these other parcels.
Yeah, I would tend to agree. That's a really good point, Jason. Thank you for raising that. I mean, so yes, I would agree with that. Is the property developed just to the, I guess that would be, I don't know what the directions are relative to this site plan.
Both of, there's two houses on the, if you're looking at the site, two houses on the right-hand side that abut the property.
Oh, yeah.
Similar configuration, house in the front and then house in the back.
And the other question too I had is lot 3. Are you going to have easements for lot 3 too? Because lot 3 is currently subdivided from 2. And who's going to have ownership of lot 3 in the final plan? Is it going to get deeded with 2 or not?
Yes, lot 2 and 3 will be deeded together as a single lot. Given the conservation 50-foot no builds a setback, you can see clearly from the plan,
Yep.
it's not a buildable lot on its own at all.
And I would agree too with Michael's suggestion too, that you're going to want to make sure you seal that well appropriately, because it is in the, it's not in the AE zone, but it's in the whatever it is, the X zone. So the potential for flooding of the wellhead, you want to make sure it's properly sealed to prevent any kind of issues with that.
It seems to me there's enough unknowns here that would really prevent us from making a decision based upon fact.
Agreed. So can someone make a motion to continue this to our next meeting? What am I talking about? I'll make a, go ahead, Robin.
I move that we continue this project to our next meeting until there's
Excellent.
further information available upon which we can make a decision.
I'll second that.
Okay, all in favor? Aye.
Aye.
The continuance, thank you. And so we'll continue this to our next meeting, or until you put it on this, if you need more time than our next meeting, just, obviously schedule it.
Sure. And is the next meeting scheduled already?
Well, if you hang on for 1 second, we'll even pick the date for the next meeting if you want. But
Sure.
I don't know, Pam, if we're talking, because it's I think our next agenda item is to set the next meeting. So as luck would have it. Pam, do you have anything else on the docket that we need to shoot for in terms of, approvals
No,
of
we
any
don't have
kind?
anything else lined up yet, so.
I mean, I would assume his septic will be on the agenda too. I would hope if the next.
Right,
meeting.
one of them is new construction, so yeah.
So I guess then,
So we'll be seeing Tim next month for sure, for two things now.
Lucky Tim.
Yep.
So is a month? Do you need we could do 3 weeks, we could do a month. It's how much time do you think you need?
I can do really just for the septic system. We just need to public notice that it's obviously all designed.
Yep.
So I'd ask for 3 weeks. I think we should be able to get everything in for that.
Will that give you enough time to go before conservation?
Huh.
Before,
I'll have to find out when the next date is, but we certainly will be submitted and on their agenda at a minimum by then.
Yeah, I think she sent an email. Let me see what she said, because somehow the 19th, it can't be the 19th, because they have it on Thursday nights. Let's see what she said.
I know that they have the 7th is one, because I'm on. I think, oh, maybe it's not the 7th. That was on.
Oh, the deadline for new filings, the upcoming 10/21 Concom meeting is 10/5. So potentially it could be on 10/21.
So if we use the 26th, then it's Tuesday, the 26th, that would get you to Concom first,
Sure,
streamline your life a little bit.
sure. I wonder if they'll say the same thing in reverse. So I'll need somebody to,
Well, they can
maybe
do the
one
same
of the
thing we would have
boards.
done. They
Yeah,
can do-
right.
Yeah, they can do the same
Right.
thing either way.
but
But
since I've already talked to you, then I'm sure they'll maybe be willing to move forward.
okay, so just looking, Lynn and Robin, can we do 6:30 on the 26th? I was up against the time today and I
Yeah,
don't.
6:30 on the 26th. Okay.
Awesome. 6:30 on October 26th is the next Board of Public Health.
okay.
Groovy. Thank you, Mr. Power.
Thank you very much.
All right. Next up on the agenda is to approve the meeting minutes. And so Amy did a lot of work getting the painstaking minutes from our two fraught meetings in August. So thank you, Amy, for that great work. Lynn and Robin, I sent some edits in. I don't know if anyone else has had a chance to review them.
I mean, I reviewed them too, and just had a few more edits as well. But it was nothing of substance. It was more just, you know, typos and.
Yep. Actually, Robin, I think you're off the hook on this vote since you weren't at the meeting. So I think Lynn, are you okay to approve these?
Yes, I'm okay to approve them. So I'll make a motion. Do we make it a motion?
Yes.
So I'll make a motion to approve the minutes. I was just trying to find the date. From
It's
There
August 10th
from
and 17th.
September 1st.
No, sorry. August
August
10th.
10th.
8:10
Oh,
and
August 10th, the one-
8:17, right?
The 10th and the 17th.
Oh, sorry, I had the wrong ones open. Yes.
Yeah, August
Sure.
10th and the 17th.
All right, so I make a motion to approve the minutes from August 10th and August 17th of 2021.
I will second that. All in favor?
Aye.
Aye,
Aye.
motion carries. Okay, moving right along. So public health agent report, and I see it in our inboxes. Pam, any highlights you'd like to talk about?
You're kind of doing a lot of more like septic things lately. And I have a consent order I'm going to send out to all you guys at the end of this meeting, a consent order for the Stop and Shop Plaza. The developer has, like, you know, conditions under which he could potentially temporarily connect that new building that's currently empty, the 390 CJC, could temporarily connect to the Stop and Shop septic system because there's some excess capacity. However, just because DEP says that you can do it doesn't mean that we're going to allow it on a local level. So
That's a
to be
temporary.
continued. So he also got permission to connect to the town sewer system. That's the permanent solution. And so in this consent order, it says a date of August, I mean, not August, October 1st, 2022. He has to be connected to the sewer, or else he'll have to start planning to do a groundwater discharge permit. So there's some hard deadlines in there, which is good. So it should be connected by next October. And
So the connection to the Stop and Shop system would be for between now and October?
it would be a temporary thing. His plan was to get some people moved in there. There isn't enough capacity to connect the whole building. It wouldn't be the first floor that's supposed to be retail. It would be of the 28 available bedrooms on the second floor, it would be 20. There's capacity for 20 bedrooms. But, you know, from a building standpoint, that's actually hard to do. You really can't parse out like which ones are going to get water and which ones are going to get sewer. It's really all or nothing when it comes to lines coming in and out of the building. So that's one of the issues that the town has a problem with. So,
Pam, is
see what
the
happens.
intention to connect all 3 buildings to town sewer? Or we just
All
doing
3
with-
have to be connected to town sewer when that becomes available. Yep.
Okay,
So there, this was just a temporary thing to get the 390 open. Like I said, it's up to the discretion of the town, not really DEP, even though DEP gave them permission because they regulate, because it's one large system, technically over 10,000 gallons per day. But when it comes to actually permitting on a local level, the town still has a say on what can and can't be done.
Are we going out on a limb by approving a temporary solution when the permanent solution may not be available?
Well, it's to be determined with the building inspector whether or not he's going to approve it.
So it's kind of iffy for us at this point.
Agreed.
When you say
Okay.
the building inspector, it's iffy for the building inspector to approve it. Improve what?
Well, because ultimately he would be the one that would issue occupancy permits,
Oh, I see.
building occupancy permits, and there's a lot of issues. That building is not really, hasn't met all the criteria that's supposed to meet in terms of, like, say, the planning board, like doesn't have the lights and the parking and you know, all kinds of things haven't been even installed yet. So when it comes to, well, let me back up. Was one thing I forgot, one critical thing. The argument to this whole thing to get this temporary connection was that it was supposed to give the town credit for affordable housing, right? And he said that there was a deadline of September 30th. Well, it turns out there is no September 30th deadline. In order to get credit for affordable housing units, the whole thing has to be complete, right? You have to have, the whole building has to have water, and the whole building has to have sewer, and it has to have all the other things that were agreed upon for the planning department. And so there's no way all that stuff's going to be done in time. So really there is no deadline. It's like whenever all that gets done and is complete, that's when, you know, they'll report that back to the affordable housing people, and, you know, that's when you get the credit. So there is no, the whole thing is kind of a red herring. There was no date. So there isn't really much to be gained by having a temporary solution.
At least not yet. So, got it. Okay. We will wait, see what
Mhm.
happens.
And then in kind of in a similar fashion, there's the Cook Estate, and we're just waiting to get these cross sections from one of the environmental consultants. And that'll be the final piece of evidence as to whether or not the complete system is in failure. Right. So right now we know 2 leaching fields are definitely sitting in the groundwater. The question is, are the other 2 sitting in groundwater as well? And if they are, then the whole thing is a failure. And it may come down to the Board of Health officially failing it, because
Pam, it's
in
not-
ordering a connection to sewer, because if they are going to connect to sewer, they got to do it relatively fast. Their options would be go up Sawyer Street and, you know, pump up and over. And if they do that, Sawyer Street's going to be paved pretty soon. And I didn't know this, but once you pave the streets, there's like a 5-year moratorium. You're not supposed to do any more construction. So that's supposed to happen next spring. So it would have to be kind of fast tracked. And if they decided to go downhill and get some kind of gravity system, that would be connecting through this new, Stop and Shop Plaza. And that's obviously being engineered right now. So you'd want to do that pretty quick. And that would be connected by, next summer or even October. So the whole thing would have to happen quickly. And the quickest way to have it done legally, it probably is to have the Board of Health fail it in order of connection. But that's to be determined. It's not happening yet. We have to still wait for the results from this green environmental in their cross section. So anyway, that's coming down the pike maybe.
Okay. Thank you. Anything else you'd like to share, Pam?
That's it for now.
All right. Thanks very much. Hi, Mary.
How are you?
Great. How are you?
I'm good. So highlights. So you see my reports weekly, right? And last week we reported 16 cases over the 2-week period prior to that. And it looks like this week, hopefully, if nothing comes in tonight or early tomorrow morning, we'll be at 7 cases. So that's encouraging.
7.
Yeah.
Wow.
So, yeah.
Mary, can I ask you a question? So I took a COVID test twice in 3 days. Does that count as one person taking a test?
Well, that's a good
terms of
question. Was it attached to an app? Like
CVS? Oh, I went to CVS for one, and then I went to my doctor's for the other.
So if you went to your doctor, then that will go to a lab that will report it to the state. Those at-home test kits, that's becoming a little bit of a.
Yeah, it wasn't an at-home test. It was like
Okay.
the CVS drive-through.
Okay, yeah, that would count. Yeah. But it depends whether they do an antigen or a PCR though, right? So if it's an antigen, it's considered a probable. If it's a PCR, it's confirmed. So
They were both PCR tests. I just didn't know if that's like I'm helping the rate by having 2 tests.
well, no, because they don't, that won't affect the numbers unless it's positive.
Okay.
So, but along those lines are the at-home test kits, which we're starting to come up against right now. So I actually right now have 2 people that did at-home test kits. And the only reason we know about them is because they self-reported. And the reason they self-report is because they have kids in the schools. So we're not going to know, I think, going forward with these test kits that people do at home. Some of them are connected with this app, and apparently then it would go to a lab would report it to the state. But if it's not connected with that, then we may not know about them unless they self-report. So, and right now the guidance from the state is they should isolate, and we are not responsible to do contact tracing for those people. So I will see more to come on that. So
I have
that's
to say 7 cases, down the 2-week average is down to 7. Well, schools are now back in session.
Mhm.
And people are starting to be indoors more. That's actually really, really encouraging.
It is encouraging. It is encouraging. Yeah. So
Back to those at-home tests, Mary. So we put in a position of having to take the word of the individual that it's a yay or a nay, or
yes, you're right. We do take their word. So it's a self-reported and it's not observed, right? So, but if someone is going to, I think, take the time to buy a test kit and then tell us that they're positive, I guess that's, pretty encouraging. But the flip side of that is someone can test at home and not tell us about it and just go about their business, right? So
exactly.
I mean, they're good and they're bad, I think. And the other thing is people early in September, it was hard to get a test because kids were going back to college. People were coming back from travel. So it was really hard to book a test. So I think they did a lot of at-home testing. So I don't know where that's going to go, but the state is kind of watching that closely.
So the question is, how reliable will that information be if it's self-reported? Generally, self-reported information is not reliable.
Right. Not only is it not reliable, but it's not witnessed. You know, it's not a telehealth visit where someone actually watches you to make sure you do it correctly. So how reliable is the test? We don't know, Bob. So that's COVID. And then flu is fast approaching. And I think you saw we've set up 4 flu clinics. They're all at Wilcott this year. And we're using the color system, so people have to book an appointment. And I've been using the Pam trained me on color, and it seems to work pretty well because you schedule the person, you vaccinate them, and as soon as you hit finished, it goes right into MIS, and I hope the billing platform. So far so good on that. We'll see when we have our first clinic, which is October 18th. Right now I have 470 doses of flu vaccine. Of that, 150 is high dose for seniors, and you do the math. What's the rest of that? 320 for the general public. So I'm finishing up my home visits. I've done about 25 or 30 people that can't get out to a clinic. And what else? I don't know. Those are the highlights for me.
I did distribute about 50 of those signs, the Board of Health signs about mask wearing all around town. It really actually ran out. So that was good.
And I
Are
got
people putting them up?
Yeah.
Good.
The seniors will have first access.
Say that again. The what?
The seniors will have first access.
No, not so much. It's pretty much open to the public.
Okay.
Yeah.
Terrific.
And
Thank
then
you.
Michael, we were saying like each meeting we would go over whether or not, the mask mandate needs to remain in
Yep.
place. So I just kind of did a quick slide. So there, can you guys see my screen?
Yes.
So this was in the order that we did in that meeting. I think it was the August 17th meeting. So both Plymouth and Norfolk counties are no longer classified as high or substantial regarding community transmission, and Cohasset will have 15 or less cases over the previous 14-day reporting period. I just want to let you know, so initially it said Cohasset will be classified as a green, but they don't do that anymore. That state kind of dropped the whole color classification thing. So, but we can still just keep the 15 or less cases. I mean, I guess it really doesn't matter what color it is.
Nope.
So each month we can, start off with this. This is our criteria, and then how did we do? So as of today, we checked the CDC transmission map, and Plymouth County is classified as high, Norfolk County is classified as substantial, so we're not there yet. And then the actual last official reporting period was Sunday, September 5th to Saturday, September 18th, and Cohasset 16 cases. So,
We
the
stay in
mask order
effect.
stands.
Yep.
And along those lines, DESI came out, I think it was yesterday, and said that their mask order will stay in place until November 1st. So.
Right.
And now
Who is that? Who is that, Mary?
the
That's
vaccination.
DESI, the Department of Elementary and
Oh, okay.
Secondary. Yeah.
Now, Mary, while we're on vaccine, does the Board of Public Health have any intent to offer a third COVID vaccine?
Yeah, so the state asked us if we were interested in participating, and we said that we were. So whenever they approve Moderna, which is what we did the first go round, whenever Moderna gets approved for a third dose, we're in line to do that.
Okay, but not the Pfizer.
No, not Pfizer.
Okay, thank you.
Yep.
And has the state said anything about when the 5 to 11-year-old vaccine comes out, how they're going to roll that out?
Well, that's interesting that we were on a call today and they talked about that and they sort of did a poll, like a live poll of, how many people are interested in doing that. The 5 to 11-year-olds, and it was kind of split. It was of 100 and let's say 70 people, 70 said yes and 50 said no. So Pam and I talked about that, and I'd be happy to help facilitate that, but I would like to see the school nurses take the lead on that if possible. That's
That's
gonna,
what I was gonna suggest. It seems like school would be the appropriate place because clearly the pediatrician's offices won't have capacity.
yeah. So if they want to partner on that, I'd be happy to order the vaccine, get the supplies. Pam said she'd do color, to set up the appointments, but we would need them to kind of take the lead. So,
Right.
yeah, but we're happy to work with them on that.
So Lynn, this is literally what came out of the call notes today, right here, about planning for 5 to 11-year-olds. Just not in place where we're rolling out vaccine for 5 to 11-year-olds. No vaccines have been approved to administer to this age group. However, based on the info we hear from Pfizer, they released last week, they suggest they have positive data around this age group. So they don't really have a projected date yet.
Okay.
And then, like Mary said, they did a poll and, 72% that it said they'd provide the vaccine.
Question, kind of a sidebar to this. The Old Goats organization, they're old and they're all goats. Are planning to have a face-to-face luncheon meeting sometime in the future. My personal feeling is that anybody who has not had the 3rd vaccine should not attend a face-to-face. What's general wisdom of this group?
Face-to-face, I'm sorry, Robin, I missed that. A face-to-face what?
Face-to-face luncheon.
Oh,
So they'll be in the corner stop. It's kind of a small area. People 6 or 8 to a table. They're right on top of each other. They maybe be probably 35 or 40 people there. And I would suspect most of the Old Goat membership have some immune situations. I personally would not go to such a meeting unless I had the 3rd vaccine. Well, what's your feeling here?
Well, if they got Moderna, which is all we gave out in Cohasset, and a lot of old goats came, they can't get a booster. It's only if you received Pfizer the first go around.
So am I taking that to understand that you would agree with me that people without a 3rd vaccine should not attend? Or are you equivocating?
I think this is a good question for your family doctor. I don't know that. So the question, I mean, we don't even have mask mandates yet overall. And so we can't even we couldn't imagine mandating the boosters. It seems to me as as a non-physician that it would be prudent for somebody who might be at risk and be a few months past or several months past their vaccination and probably needing a booster to probably not go into an indoor dining situation like that with a bunch of people. But it's hard to know, right? It's hard to know.
Yeah, I wouldn't depend upon the family physician because this is more of a group dynamic.
Mm.
And usually these groups seek the wisdom of not necessarily their elders or their youngers, but wisdom of people who would have good information. So that information has been asked of me, and I tend to be on the safe side. I just want to know what, without putting you all on record.
I think we're all on record now.
Whether you think people should have the third to be safe.
I think once the third is available, yes, they should have it. But as Pam said, most of those old goats got Moderna, and so the third's not available yet. So with that in mind, they should err on the side of caution. And I think it's kind of a personal choice, right? Because we can say what they should do at Old Goats, but how do they live the rest of their life, right? So, you know, I think if you're at risk, you still need to be cautious.
Right.
Great, thank you. That's enough guidance for me.
And now Mary's on the record. Okay, excellent. I have no update for me. So does anyone have any other agenda items not on the agenda that you would like to talk about? Otherwise. Okay. Can I get a motion to adjourn then?
Make a motion to adjourn.
I'll second that.
Nice. All in favor?
Aye.
Aye. Motion carries 3-0. Thank you, everyone.
Thank you.
Have a good
Night.
night.
Thank you.
Thank you.